and welcome to the Arrivals Podcast. I'm your host,
Hi.
Merelise Wilson, and today I have Amy Meehan with me.
Yes. Excited to be here. Thank you for having me.
I'm so excited you're here. Amy is a mom, a business owner, a physical therapist, and you specifically specialize in women's health. And so I'm so excited to talk to you, to hear your birth stories and hear how your profession has shaped your birth experiences, what your preferences were, everything.
All the things. Yes, they definitely have. After 3 kids, how far apart? 12, just turned 9, and then 18 months, which is wild.
I love it.
All different experiences, going from very much not really knowing what I'm doing to kind of slowly seeing how my birth stories change from just the knowledge and the education that I honestly had to seek out for myself, which is kind of sad, actually.
It is. I can relate to that. Absolutely. So I guess let's start with your first birth, with your oldest daughter.
I know, it's so funny. It seems like eons ago because she is 12 and a half, 6th grade. Send out the prayers into the universe, please. That's where we are right
All
now.
All the good vibes. Yes.
I'm like, can we put her back in? No, you can't. Okay. No, it was awesome. Got pregnant fairly easy with her, had a great pregnancy. Of course, the first trimester just right? And then I was like, this is great. Pregnancy is suiting me well. I'm a PT. I know all the things. I'm going to do my exercises. I'm going to work out. I mean, I was running, doing CrossFit. I mean, I had great fit pregnancy.
Yeah.
It was fantastic.
Yeah.
And then was good to my OB appointments, didn't have any gestational diabetes. Like I really had a good, healthy pregnancy. And then when it came time, even when I started having contractions or what I thought was contractions, I'm like, I don't know what to do now. I just felt like at every appointment, I'm like, well, how will I know? They're like, oh, you'll know. But then in reality, you start having contractions. You're like, is this it?
Yeah.
I didn't even know what timing my contractions was with my first.
Wow.
Like it was like that. And I have an older sister. I was one of the first in my friend group to kind of have kids. Have an older sister. She had just had her second. I was there for both of the babies, right?
Amazing.
So I like knew what that entailed, but I just didn't think to ask the questions.
Yeah.
I didn't know what I didn't know.
That's what's so hard. You know, when you go to a doctor's appointment, an OB appointment, when you're pregnant and they say, what questions do you have?
And I don't even know what to ask.
I don't know.
I know. I'm like, I thought you were going to tell me, right?
Yes, exactly.
And I think that's my favorite thing now with Revelle is now we have people like yourself that'll be like, you have to go see Amy. You have to go see Revelle. And we'll have people come and sit in our chairs and are like, my friend said I absolutely had to be here and I don't know why I'm here. And I'm like, oh my God, I will tell you everything.
Yes.
And what I would have given that for like my first birth to get from my OB or my midwife or something.
I know.
So I started contracting at home at nighttime, usually is when it starts.
Right.
I mean, my contractions were like 20 minutes apart.
And did you have a birth plan going into it?
No, didn't even know what that
hospital.
was. I was just winging it. I was like, let's go. Surely everybody does it. How hard can it be? Right. And everybody's like, oh yeah, it hurts and this. And so you just think, all right, I'm going to go in. I'm going to tell the doctor I'm having contractions. They're going to give me an epidural and then we just push the baby out.
Right.
Like that's literally all I thought this was. So that's what I did. And I'm like, okay, I'm going to have contractions. And I call and I'm like, okay, I think I'm having contractions. And they ask me, well, how long have they been going on? How long are they lasting? How far apart are they? And I'm like, I don't know. And so then we didn't have like the apps and stuff, right? I feel like I'm so old, but I'm not.
You're not. You're really not.
And so I'm like timing it. I'm like writing them down. And so finally I'm like, okay, they're like, when they get to be, you know, the rule is like 5 minutes apart, lasting at least 1 minute for as long as an hour. So I did that. And then I just roll up to the hospital. Didn't call them back, nothing. Now it's like 3 or 4 in the morning. And they're like, oh, well, we didn't know you were coming. We're going to sit you in the waiting room. And I was like, okay, cool. I didn't know any better, right? Yeah. I'm at Northside. And so we did our tour and all of that. So we at least knew where to go.
Right.
But I remember sitting in the waiting room, still filling out paperwork. And I'm like, I think I'm having contractions. They were still like 15 minutes apart. Yeah. I mean, like it was crazy.
Very minimal.
Get to my room, you know, they hook you up. You think you're just like bed bound at this point. Like you just don't know any better.
Yeah.
So they have the monitor on me. They hook you up to the IV. And so I sit there and they're like, okay, well, I mean, you're having contractions. They're still like 12 minutes apart. Do you want to go home? And I'm like, first birth, you're like, I am not going. I can't go home.
No.
I'm about to have a baby. It's going to come right now, right? You just have no idea.
And you've already put on the hospital gown, probably gotten hooked up, and you're like, oh, I don't want to feel so anticlimactic to go and then, you know, leave and come back.
False alarm. Like I think at that point I was like 39 in a couple of days. So it was, you know, and I'm like, it's time. It's time. So it's like, oh, we'll just give you some Pitocin. I'm like, oh, that sounds good. What's that? you know? So I take my IV, they hook me up with some Pitocin, and then I'm like starting to have contractions.
Yeah.
And the great part with this is one of my best girlfriends was she was a NICU nurse at Northside.
Oh.
And she comes down and she's like, I just remember walking in and you were like gripping the side of the bed. It was only 4 centimeters.
Mm-hmm.
I had no idea what was happening to my body because contractions hurt. They're supposed to.
And Pitocin contractions hurt more too.
And she's like, I think you need your epidural. And I'm like, oh, yeah, sure. Okay, I guess that's what I need. So she called for the epidural, came, gave me the epidural, and then you just laid there. And they didn't flip me. So only one side was numb. And then I'm like, I still like feel some stuff, you know? And it's all I felt were like lower one-sided contractions that were like a 2 out of 10. But I didn't think I was supposed to feel anything.
Right.
And they're like, oh, well, we'll just give you some more. And I'm like, oh, why not? Sounds good. And so now same thing. They're like, flip me on that side. So, because, you got to rotate to get you got to shake it all up a little bit. Right. And so they lay me on, this is on my left side now. And they had souped me up so much. Now my hand, I have no function on my hand.
Oh my God.
Arm. It was wild.
I've never heard that.
Oh yeah.
Wow.
So now I'm freaking out because it's like I know enough to like freak me out, but not enough to ease my mind.
Yes.
So now they're like, okay, well, time to push. And I didn't know what I was doing. I didn't know how to push. So they just checked
and they were like, you're 10 centimeters, time to push.
Time to push. And so it was like, I got my epidural. I don't remember much at that point. And then they just kept coming back and checking.
Yeah.
And can't get up now. So second like bolus that I had. And I remember trying to hold my leg and I was like,
your hand,
grab my good hand kind of thing.
I wish you could see Amy's hand right now. It's a limp wrist.
It's like a little limp like noodle. And it was like, I just hooked it underneath my leg.
Oh my God.
My husband's on one side and I'm just like grunting and bearing down. And then 3.5 hours later, that's wild.
That is insane. I just got chills. Like imagining you pushing for 3.5 hours.
What? That's like should be illegal.
Yes.
Like that should be illegal.
Oh my gosh.
And so finally, my sweet little Maddie girl made it into the world. Super cute, happy, healthy. She was, how big was Maddie girl? Maddie was 7 pounds, 10 ounces.
Okay.
I had 2nd-degree tearing. I had prolapse. I had hemorrhoids. I wound up having constipation. Had painful intercourse. I mean, you name it, I had it. Go back for my 6th week. And I'm like, this shit hurts. Like, what is going on right now?
Yeah.
And the funny part, I remember my mom was in the delivery room. She was like very, like kind of in the back. She didn't want to alarm me. My sister was in there. And I remember my mom coming home with me, like driving home. And I was in the shower and I was like, I think we need to go back because I don't know what I'm doing and I hurt really bad. And she was like, yeah, that's not how it works. Yeah. Like, this is where we are. So I go to that 6-week follow-up thinking like, okay, we're going to do this. We got this.
Right.
And then it was my midwife at the time that I was seeing at this larger practice. And I said, I'm just like not feeling okay. Like everything hurts. Now I'm probably 6+ weeks. And she's like, well, give it 6 months. You just had a baby. And I'm like, I cannot give my body 6 months of feeling like this.
No.
And so in my mind, I'm like, okay, I have my doctorate in physical therapy. Like we had one lecture on pelvic floor rehab.
I was going to say, at this point, were you focusing on pelvic floor or what PT were you specializing in?
I was thinking, and I was not. I was just like outpatient orthopedics. Okay. So I was treating all the knees and the hips and all the like things that you think, because you're in your 20s when you're in PT school. Right. If you go right after you graduate. And then you get this one lecture on pelvic floor and it's like lube and dilators and all the things. And you're like, this is not why I went to PT school.
They're not selling it well.
No, not at all. Not at all. And so you're like, where's that one lecture? So you're like fishing through all your stuff, trying to find it. And so I found someone in Atlanta and I went and it was in like a doc in the box, like orthopedic. And I just remember going in fearful anyway, did not put me at a peace of mind, in a sports clinic, mind you. And she was treating this like football player with me.
Oh my gosh.
So I'm in a room and she's like, go ahead and undress. I'm going to finish up with him. I'll be back to do your assessment. And I go in and I'm in like the paper gown with stirrups and everything, which is awful. And the guy's doing wall ball on like right above my door. And she's like, comes in and she's like, just try to relax. And I'm like, my door is going to swing open and this was awful. And so I left crying.
Oh my God.
And I did that till I was about 6 months postpartum. And then I just went to my husband crying and was like, something has to change. Oh my God. Like we cannot let women go through this birthing experience
No.
without any support. And that's how we created Revelle.
And I'm going to
And
guess
here we
actually
are.
too, if you want to,
Yeah.
yes, that's how we met is so
Uh-huh.
I went to go see Amy when I was postpartum with my second. I suspected
Crazy.
I had ab separation, but I just
Mhm.
had a lot of other symptoms and I just really wanted to make sure I was in a good place,
Yeah.
just knowing what my body had been through.
Mhm.
And so I went to see Amy and someone had recommended Revelle and I walked into this space and it's the most beautiful, calming, loving, peaceful space. The
Mhm.
total opposite of what you're describing.
And that is why it is that way,
Yeah.
right? It's like no stirrups, tables are heated, soft linens, nice colors, dimmed lighting,
So
like
private, like
so very like we want you to come in and feel at peace because that's what
yes.
we deserve. And that is just not what I got through any of my birth experience. It was
Yeah.
like, okay, you feel like you're at like a meat counter. You're like,
Yeah.
number 42.
I know.
You know?
Yes.
And so, again, that's why Revelle got started. And then finally, I got up the courage to be like, I think I want another baby. Can I do that again?
Mhm,
And
mhm.
like, I know so much more now.
Yeah.
Got all my pelvic floor work out of the way. We created Revelle, childbirth educators. Like, I was like, I cannot do this again without knowing. And then I set forth to say, I'm going to do my best to not let any other woman experience what
Mhm,
I experienced.
mhm. So you started Revelle with a newborn, basically.
Pretty much.
I did not realize
Oh,
that.
yeah.
Wow.
Oh, yeah. It was like grassroots. I
Wow.
mean, I was just determined, right?
Wow.
And so then 3.5 years later, got pregnant with my
Mhm.
second. And I'm like, we're going to do it differently.
Yeah.
I did not switch practices just out of comfort.
Mhm,
Sweet, sweet Macy. She's my big girl. She was 8'6",
mhm.
but very easy.
Yeah.
Very, very similar pregnancy.
Mhm.
Obviously, with a toddler, it's a little bit different, right?
Yes. You're a little bit more tired.
Yes. And then again, going back and forth with the doctor, everything was fine. And then finally, it was kind of like, what are the expectations? I'm like, this is kind of how I want to do things this go around.
Mhm.
I'm like, I would like my epidural, but I would like to wait until I'm in active labor
Mhm.
between 6 and 8 centimeters.
Mhm.
They're like, okay, sure. They didn't give me any pushback, but they didn't recommend any of
Right.
this stuff with my
Right.
first. And I said, okay, I would like to try X, Y, and Z before I get the epidural.
Mhm,
I want to be able to walk the halls.
mhm.
I want to be able to get out of the bed. I don't want to have constant monitoring
Mhm.
if I can help it. And they're like, oh, yeah, we can do that. So the second birth, much different.
But isn't it so crazy that like the only reason you knew about that is because you'd taken upon yourself to learn about it.
Yes.
Like, and then it's great that they were okay
Yes.
with it. They didn't push
Yeah.
back, but
Mhm.
why are we not talking about this
Yeah.
proactively in these
And I think it's like
appointments?
it's out of ease. And
Yeah.
so I've been in this practice now for a while and been able to have like the privilege to talk with lots of OBs and
Mhm.
midwives and nurses and everything.
Mhm.
And it's just like the nurses are told what to do.
Mhm.
And so when people are like, well, my nurse didn't let me. And I'm like, I understand that. However, nurses are to take orders from their attending,
Right.
right? And so you still have to advocate
Mhm.
no matter what.
Mhm.
And you have to go in mentally, not with a rigid plan,
Right.
but knowing my body, things could go this way, they could go that way. Like,
Mhm.
what are my options going to be? Do I have any
Yes.
hard no's? Like, am I okay with forceps?
Mhm.
Do you even know what forceps are?
Right.
For
You shouldn't
me,
be finding out when they're
no.
asking you if you're okay
With the
having
salad
them.
tongs,
Yes.
right?
Yeah.
You're like, oh, what are we doing? They're like, oh, these are to stick into your vagina and get your baby out. And
Right.
you're like, I'm going to go hard pass.
Yeah.
Personal preference for
Yes.
me, right? Or it's like, okay, if my cervix isn't soft, do I really want Pitocin? Like, can you tell me where my cervix is? Like,
Right.
that just wasn't a conversation with my
Right.
first. And so the second go around, I was still very much mentally terrified
Mhm.
to give birth without an epidural because I thought that it was actually pushing the baby out that was going to be the most pain.
Mm.
Like that
I
you
found
really
it wasn't. That was almost a
yes.
relief. But
Yeah.
yeah.
And I think that's what's so crazy. And that's one of my big things I talk with a lot of my patients. I'm like, from my experience, it's not the baby exiting that
Mhm.
everyone fears, right? When you might have some tearing or some this or some that. I'm like, that is just a blip on the radar
Yes.
versus those contractions that you
Yes.
have
100%.
during, transition, which is between 8 and 10
Mhm.
centimeters.
Mhm.
So had sweet little Macy Kate. She was, like I said, she was my big girl. Didn't
Mhm.
have, I think I had like a grade 1 tear
Okay.
right where I tore the time
Yeah.
before.
Do you remember at what point you got the epidural with her?
I think I was able to wait till about 6 centimeters with
Great.
her. So
That's
that was like
awesome.
my goal.
Yeah.
But then I still had preached into me when I was in the hospital, like, well, you should just probably get it
Mhm.
because we know the anesthesiologist is available, which
Mm.
in my head, I'm like, that is on the bank. That's bullshit.
Yeah.
I mean, it is. So
They should be working around you, not
right,
the other way
right. Not
around.
like, oh, are you available? Pencil me in at noon.
Right.
Like that's not how this works.
Yeah.
And so I probably could have gone a little bit
Mhm.
longer, but same thing. It was more of like a fear for
Mhm.
me.
Mhm.
But the cool thing with this go around is I did know a little bit about laboring down.
Yeah.
So if I couldn't be up moving during labor to help with those
Mhm.
contractions and
Mhm.
optimize those contractions, I said, can you guys like put me in like an upright position?
Yeah.
So Northside gave me like the throne,
Mhm.
and they're
Yes.
like, let us know if you feel pressure. And I was like, you got it,
Yeah.
sister. And then I was on my side with a peanut ball for a
Yeah.
little bit. But I think being able to labor down, I
Mhm.
went from 3.5 hours of pushing. And my husband looked at me and he's like, babe, we can't do that.
Mm.
We can't do that again. He was like, 30 or under. And he was like dead straight in the face. He was like, we got this.
Yeah.
28 minutes later, I
Oh,
had her.
that's amazing.
And such a better recovery,
Yeah.
right? Still very similar symptoms.
Mhm.
Found one of my girlfriends who partnered with me, like had her treat me after my second,
Yeah.
and just the rehab and the whole process
Mhm.
mentally, game changer for me.
I found with that second baby, most of the time, no matter what your birth experience was, the
Mm-hmm.
postpartum with the second is almost always better just because you know what
Mm-hmm.
to expect.
Yeah. Yeah. And I
So,
just think the mentality of like, I was so down on myself after my first
mhm.
that, and you don't know, even the mental health aspect,
Yeah.
I probably did deal with some postpartum anxiety and just
Mhm.
like sucked all of that in. And then a lot of that actually came out after
Yeah.
my second
Yeah.
because I was almost like open to like feeling my feelings. Do you know what
Mhm.
I'm saying?
Totally.
And so how to get some help for some postpartum anxiety.
Yeah.
And I think that's probably why I waited another 8 years before I had another one, right? And then decided, are we done? I'm not as young as I used to be. Neither is
Mhm.
my husband, but like I felt like I was done. And I said, okay, I'm going to give myself a year
Yeah.
and we're just going to live life.
Mhm.
And if we do, we do. If we don't, we don't.
Mhm.
And then it was like October of 24. And then mentally it had like closed up shop. And then
Yeah.
I get pregnant.
I've told so many people
Oh,
your
yeah.
story. I love it.
And I'm like, I think mentally I was like, okay, just I have my two girls. It's fine.
Yeah.
We're good. And so I almost went into like a little bit of a depression, being like,
Mm.
oh crap. Like, I don't know how to do this. It's been so long.
Yeah.
And I said, no, I'm changing the script this time. Like, this is going to be my birth. I know way too much. I've
Mhm.
heard too many birth stories. I know how I want this to go.
Mhm.
And I'm going not necessarily to control, but I'm going to guide this in the way I want to go.
Guide is a great way to put it.
Switch practices, midwife, concierge. Again, I had the luxury to be able to do that this go
Yeah.
around. It was going to be one of two providers at my birth.
As opposed to like 6 or 7 or
Right.
ugh.
And just the unknown. And I
Yeah.
think I was trying to eliminate some of the fear that I
Mhm.
had with birth by, again, I can't control the actual action of my birth, but I can
Right.
control like, where are my providers?
How
Where am
many
I
providers?
birthing? Yes.
Right.
So it was a midwife and her partner. One of the two of them were going to be at my birth.
Mhm.
My appointments, I could get in, get out super easy.
Did they allocate more time at
Oh
your
my gosh.
appointments? Yeah.
I,
That's what I've heard.
it was so easy. It was so great.
Mm.
I had one scare with my blood pressure, and
Mhm.
instead of shipping me off to the hospital, they were like, okay, you're pregnant with your third,
Mhm.
you run a business,
Mhm.
your husband is in a different country. Let's give you 5 minutes,
Yeah.
which I don't feel like I would have gotten that elsewhere.
Yeah.
And so she was like, I'm turning the lights off
Yeah.
and I'm going to put some music on and I'm going to prop your feet up and I'll see you in 5. And she
That's
comes back,
awesome.
blood pressure completely normal.
That's so great.
And so it's just like being able to kind of have someone on your side, right?
And that continuity of care, like understanding your background and the context, like knowing that your
Mhm.
husband works, he often is
Yes.
traveling for work, knowing that you're building a business, like
Yeah.
just knowing more about your patients because you have fewer of them and you're seeing less providers. Like
Yeah.
that continuity is so important.
It was great. It was really, really great. And then she's like, okay, kind of talk me through. We actually had a conversation about
Mhm.
birth. She's like, okay, what do you want? And I said, I kind of want it to be a little hands off. I'm a very pro hospital birth. Like I said, I know too much for me personally, but I just didn't want to be poked and prodded if I didn't need to be poked and prodded.
Yeah.
I was actually really fearful to have a lot of the medications because I was afraid that was going to exacerbate my anxiety.
Mm.
And I have two older girls that look to me for everything. And I just knew mentally I had to be 100% for them.
Mhm.
And so that was my driving like mentality of like, I don't want medication.
Yeah.
I don't want Pitocin.
Mhm.
I don't want morphine. I really didn't want anything. And
Mhm.
it was for them.
Yeah.
Mom has to be on her A game because they're at that age now where like they're going to remember everything.
So were they at the birth of your
They were
third?
not at the
Okay.
birth, but they knew enough to where my water broke at home with this
Oh.
one. It was 39 weeks. I blame it. We went on the boat like the night before.
Got you all rocked.
Got me prepped and ready. But we were like bouncing around.
Yeah.
The girls are back there like surfing behind the boat. And
Yeah.
I'm like, I'm exhausted. And my husband's like, well, here, sit on the swim platform and use the restroom. He had like plopped me down in the water.
Yeah.
And so I do my business. And I was like, babe, you got to help me back up. So he pulls me up by my life jacket and he didn't get my butt cheeks like on the swim platform. And I just go, no, and like fall face first to the water. And he's like, what happened? I'm like, you got to like, I'm like front heavy.
Yes.
And so I swear that and bouncing around in the boat
Yeah.
probably was like jiggled him down just enough.
Yes.
And so the next night we're sitting at dinner and I'm like, I just don't feel so great.
Yeah.
He's like, well, just go lay down. I was right at 39 weeks.
Mhm. And I forget your first was born right around 39.
39
Second.
and some days. She was 3 days early.
Okay.
The second was she was due on the 23rd, had her 6 days early.
Okay. So you've always been a little early.
Mhm.
You've
Always
never
been
had to be induced. You've always, other than the Pitocin.
Right.
The first.
Yeah. I feel like with my first, I would consider that an induction because Lord knows.
Yeah.
And so I like go and lay down and then my water has never broke before. And I'm laying in bed and I feel like that pop. It's like a physical internal pop. And you're like, was that more water? Maybe. I know enough now, right?
Yeah.
And so I stand up and was like, absolutely that my water just broke. And so my husband's on the front porch. It's July. We have like big front porch and he loves to go out there and drink his little Jack or whatever. And I go out and I'm like, hey babe, I think my water just broke. And so he goes into like full panic mode, right? He's like, okay, let's call your sister. We got to do it. And I'm like, it's fine.
Right.
Because remember, we'll call the midwife and tell her. And she's like, great. Just chill, relax, wait, call me when you start having contractions.
Right.
We really, want things to start progressing within 24 hours. So chill.
Something that I didn't know until, so my water broke with both of mine.
Oh, awesome.
But something I didn't know before I had children is that your water breaks and contractions might not start.
They might not.
For quite a while. And providers never told me that.
No.
It was just like, you hear about the shot clock a lot.
Yes.
Like 24 hours after your water breaks.
Yes.
Like that's the only thing you hear.
Uh-huh.
But no one really had told me that you might not get contractions started for hours.
Yeah.
And that's normal.
Yeah. I think mine, it was a couple hours before mine did.
Yeah. So
and
a lot of people go straight to the hospital when their water breaks, but you don't really
then what, right? You're like, it's all about the contractions. And I think that's the education that a lot of people miss. And I think my husband was like, you're just like really chill. And I'm like, well, I know what my body's trying to do.
Yeah.
And that's one of the biggest things I think during some of our sessions when we talk, we see a lot of birth prep and a lot of it's education and getting these women to understand their bodies, right? Like I'm going to do this one day and we'll have to work together of I want to get women to give me a 30-second description on what contractions feel like because Lord knows what we would get, right?
Yes.
I mean, because it's something you almost can't describe.
Yeah.
You can't describe that in words, but it's just getting women to understand their bodies. Like when you think contractions, do we know what's contracting?
Right.
Do we know why it's contracting?
Right.
In my head, I think, okay, contractions, great. The uterus is a muscle. That muscle contracts from top down. Baby's head is low, sitting on my muscular cervix. Every contraction is meant to efface, thin, and dilate open that cervix.
Right.
So what can I do to maximize these contractions so I have less of them?
Right.
Because you're going to have contractions until you get to 10 centimeters and have that baby.
Yes.
And the moment that baby exits, they almost immediately stop.
Yeah.
Which is wild.
Yeah.
And so I was like, okay, I'm not having contractions yet. I'm going to go take a bath. I'm going to go tell my girls, right? Because they, like I said, they're at that age where they knew enough. So I go up into my oldest daughter's room and I'm like, hey, babe, I think my water just broke. And she just burst into tears. She was
Oh.
like, is it time? Is it time? Are we going now? Like, I said, I'm going to stay home. Aunt Dee Dee's going to come get you guys. And she's so excited.
Yeah.
And then I walk into my other little girl's room because it's like 9 o'clock at night.
Yeah.
I walk into my other daughter's room. She was 7 at the time. And I'm like, hey, Mace, like mommy's water just broke. She was like, are you about to have the baby like right here? Like she doesn't quite get it yet.
Yeah.
And I'm like, no, like you guys are going to go here. Mommy's going to go to the hospital in a little bit. And she was like, oh, thank goodness. That would have been messy.
Kids.
Like the things they say. And so that's just their
She's right.
personalities too. Yeah, she's definitely right. So we did. My sister came and got them. We chilled out the house for a little bit.
Yeah.
And now it's like 3 a.m. And it's like, I'm on my ball next to my bed. I'm like trying to chill. We have our stuff packed.
Was your water actively leaking? Because with my second one, it was like really messy. Like
like the first probably 2 or 3 hours, I'm like, I can't. I have like puppy pads and underwear and all the things. It's like I just had a towel at the very end.
You kind of just have to walk around with like a bowl between your legs.
You pretty much do. So I got in the bathtub and that helped. And then I got into the shower after that because then I felt gross being in the bathtub.
I know.
But that just kind of helped me just relax.
Yeah.
And that's the other thing that a lot of women don't know is in my head, I'm like, optimize contractions. We want this to continue to progress. It's all about progression.
Right.
Well, there's hormones that come into play with that. So oxytocin is the main driver of your uterine contractions, hence Pitocin, the synthetic form.
Right.
And so what helps promote the production of oxytocin? Melatonin. We can't pop melatonin, but our bodies naturally produce melatonin.
Right.
So what can I do to help stimulate that melatonin? Well, what do I do at nighttime? I love to take a bath. I love a good lavender. I love a good Epsom salt. I love a good book and dimmed lighting. Yes. And my white noise, which is from the baby monitors after kids. You just keep it in the room. My kids don't even have monitors anymore. And so that really curates that nighttime experience for me. But what if we did that in the hospital? And why are we not?
I know.
Because on the flip side, what inhibits the production of oxytocin? Adrenaline.
Bright lights.
Hello, hospital.
Strangers.
Yes.
Right.
Beeping noises, just like the anxiety, the anticipation, right? And so I always tell everyone when you get to the hospital or you get to where you're going to give birth, recreate that. And I have so many good friends that are doulas and I'm like, you have to give them the science.
Yeah.
This isn't woo-woo birthing.
Right.
This isn't woo-woo.
Right.
This is to help your body get into the state that it needs to be in to help you progress.
It is science.
It's
hormonal.
Truly science. Yeah. So at home, I got to about 6-7 centimeters. I mean, no, I didn't. That's a lie. 6 to 7 minutes apart with my contractions. Get to the hospital. Guess what? They're 7-8 now.
Okay.
Because I still was kind of anxious getting there and everything.
So why did you decide to go at that point?
My sweet husband, he was like, babe, am I sleeping? Am I staying up? I'm tired. I don't know. It was honestly, I went to the hospital for him.
I feel like I hear that so often. They're nervous Nellies.
He just said again, it's 3 o'clock in the morning. He's like, I'm afraid to go to sleep. Should we go? What do you want to do? And I'm like, we can just go.
We mother everyone. Let's be honest. It's not
really
just our kids that we mother.
And so we go, we're walking in. He's carrying all my stuff. You can tell he's kind of panicking.
Yeah.
Called the midwife. She met me there. She's hanging twinkly lights in my room.
Oh.
She's getting the birth ball.
That's amazing. Was this at Northside again?
This was at Wellstar in Roswell.
Yeah.
And you literally walk into the floor. You can park and walk 100 feet and you're in the hospital. It's wild.
That's awesome.
Wild. Didn't even know they did that.
Yeah.
Sweetest nurse ever. Again, still following rules. My midwife comes in and she's like, all right, let's hook you up to the monitor. I think it was 20 or 30 minutes. We have to do continuous monitoring for 30 before we can take it off and just do intermittent.
Okay.
Great.
And did you have a doula or just your midwife?
Just me and the hubs.
Yeah.
I did have some of my doula friends come over and do a crash course.
Yeah.
More so for him than me because I actually teach childbirth education courses, but he would take instruction much better from someone else.
I know.
And so he did great. We figured out what I liked. He figured out how to help me with shoving the ball here and there and all the things, right?
Advocate for you.
Oh, yeah. Oh, yeah. He's like, okay, we don't want this and we want this, right? Which was great.
Yeah.
So get into Wellstar. I have my ball. I change into my robe. She turns the lights off. She's literally tacking twinkle lights behind my bed.
And did you bring your own robe and stuff?
I did. I brought my own.
That's something people don't know is you don't have to wear the hospital gown.
And I'm not going to keep it after anyway.
No.
Like go spend your $12 on Amazon
Right.
and I'm comfortable.
Yeah. Get a soft robe.
Yes.
Yeah.
And I'm my little slippers. I had my
Mhm.
playlist
Mhm.
and I'm like listening to my like, worship music to start. I was
Mhm.
just like in my zone,
Mhm.
right? We have the little sound machine in the corner. I mean, it was just very chill. He's trying to sleep on the uncomfortable couch. He's like, just let me know if you need me. And I'm just like rolling
Yeah.
and walking around the room and just in my zone for however long.
And so with this one, did you plan to not have an epidural?
I
Okay.
mentally went in
You
and was
wanted to.
like, because again, I'm like, I don't want any drugs.
Mhm.
I don't want any pharmacological management
Mhm.
if I can help it. Right. Like if you need to stop my bleeding, obviously.
Yes.
So if I don't absolutely need it, I don't want it.
Mhm.
That was my mentality.
Did you do any sort of mental preparation?
So for me, I think a lot of mine was I kind of take what I teach every single day,
Mhm.
right? When we talk about the importance of breath work,
Mm.
when like again, I in my practice, I try to take like, okay, I know that this connects to this and this connects to this. And I'm like, you need to breathe because it's going to help calm your nervous system. Whereas in my head, I'm like, if we can get you to get the diaphragm to descend, that's going to activate cranial nerve 10, which is your vagus nerve that's in charge of your fight or flight. Like that's where my head goes.
Yeah.
So it was like I took those things that I knew and were teaching and everything into my own birth.
Mhm.
And so I said, okay, my breathing is everything.
Yeah.
Like it truly is everything. Your mental headspace and the clarity that you have is everything. I had my birth comb.
Mhm.
I had my TENS unit.
Mhm.
I had my cooling rag. I had all of my things.
Yeah.
And then same thing, those aren't just to say like, oh, those are distractions. Well, they truly are.
Mhm.
Taken again, science, our body can only handle so much input. Our sweet little brains can only handle so much input.
Yeah.
So if you give all of the input from your uterus and all of that discomfort, and that's the only input you're giving your brain, it's only going to focus on that
Right.
discomfort. It's very hard
Right.
to manage that.
Yeah.
But there's something really cool called pain gate theory.
Mm.
So the brain can only tolerate, like I said, so much input. So why
Mhm.
don't we flood it with additional inputs?
Mm.
So that's why a TENS unit is good, transcutaneous electrical
Yeah.
stim. It's just like on the surface. It's almost feels like almost like a little numbness and tingling with the little
Mhm.
pads. People have probably seen it before.
Mhm. I wish it was used more often.
Oh, it's
And
amazing.
yeah.
It's amazing. Put it on your back, bracket around that nerve that goes to the uterus. I mean, it's
Mhm.
great. So very, very easy, something simple to do. $20 on Amazon.
Right.
I need
You
to
don't have
have
to be a doctor to have
it.
one.
No, absolutely not. You can get it off Amazon.
Yeah.
Simple, easy instructions. YouTube it if you need to.
Mhm.
I mean, it's super easy. Birth comb. You are taking a comb that has, we'll say, 20 fine points and putting it into your hand,
Mhm.
which is the most sensitive area of your body.
Mhm.
And you are giving it, squeezing it in your hand, and you're giving yourself 20 fine point inputs
Mhm.
now going to your brain.
Yeah.
Then you have the sensation of cold. The sensation of cold travels faster to the brain than the sensation of pain.
Mm.
So now your brain is being flooded with all these additional inputs. So it almost kind of masks the pain
Right.
from the contractions.
Right.
That's a win-win right there.
Yes.
And I always say, take your non-pharmacological pain management strategies, and it's to get you through one more contraction.
Mhm.
That's it.
Yeah.
If we can postpone medical intervention, the less likely you're going to have additional medical interventions.
Right.
Time and a place for them.
Yes.
So that's what I did. I'm rolling on my ball. I'm starting now. They did check me. They didn't check me until I was 6 centimeters.
Okay.
Was I begging for the epidural? Of course I was, because most of us do. And at that point, I look at my husband. I'm like, I don't think I can do this. And the midwife looks at him and was like, well, we know what she said she didn't want to do, you know? And so they knew this. I did not want any drugs. The midwife and my husband both knew. And they're like, okay, now it's their role to help me get through one more contraction. Here we go, babe. And you feel it. They're like waves. I tell everybody they're like waves.
Mhm.
It's like you feel it coming on and you're like, oh no, not again. And then it peaks and then it totally comes down and you get like a little second of reprieve. Then you feel it creeping up again. And then if we can increase that input during the peaks of contractions,
Right.
I mean, granted, you're still saying a lot of choice words. At least
Right.
I was.
Yes.
I was like, oh no, here it comes again. And then
Yes.
I'm like, oh shit, you know, all the
Yeah.
things.
All the things.
And so, but it did. It got me through one more contraction,
Yeah.
one more contraction. And then finally, I was just exhausted. I couldn't be upright anymore. I was like, I just want to get in the bed. I'm
Yeah.
so tired.
How long had it been from?
Let's see. So I got there at like 3 a.m. It went fast.
Yeah.
I got there at like 3 a.m. I had him at like 5:30.
Okay. So this
It
is
was
fast. Yeah.
So this was
fast.
progressing really fast.
Okay.
So I get there. I'm chilling for maybe 30 minutes. I think I got there and the way my contractions were, I was probably at like 4,
Mhm.
but manageable.
Yeah.
And then they checked me when I was like, this really hurts. And
Yeah.
they're like, I was at 6, but she's like, I can actively feel your cervix dilating.
Wow.
She's like, you're progressing really, really
Yeah.
fast. She was like, just keep going.
Mhm.
And I'm like, I don't think I can do it. I think I need the epidural. And they're like, well, you need to take a whole bag of IV fluids before that.
Yeah.
And I was like, that's fine, and I'm like kind of getting discouraged at this
Right.
point. Like,
Right.
I really wanted to do this. My husband's like, it's okay. Like, you still have time to take it.
Mhm.
So now my contractions, I have no reprieve.
Mm.
It's
Mhm.
one
Back to
after
back.
the back. Like, I mean, and now I'm having to do that very like visceral breath of like that, like almost a moan and like a vibratory breath to just like try to get through them.
Mhm.
And then they'd break, I kid you not, for like 10 seconds. I mean, it was just one
Yes.
wave after the next.
Yes.
And the midwife looked at me and she's like, this is transition.
Right.
She's like, you're about to meet your baby. And I was
Yeah.
like, okay. And then I was like, how much more of the IV bag of fluid? My husband goes, you've had about a fifth of it. And then I started pushing like 5 minutes later.
Yes.
And so got through transition. And that to me was like, that was it. And I look at my midwife. She's just sitting calmly on the edge of my bed. And I said, I think I need to push.
Mhm.
Slid down on my side.
Mm.
And 5 pushes later.
Wow.
Mm-hmm.
It's amazing.
Yeah.
So you pushed, she was birthed, or he was birthed. It was a boy this time.
Yeah, 3rd was a boy.
You pushed on your side the whole time.
On my side.
Mm.
And it's so much easier. I
Yeah.
had so much control.
Yeah.
The nurse at one point was like holding my leg in a funny position. And I was like, I don't really like that very much. And she's like, okay, where do you want it? I was like, pull my knee down.
Yeah.
And it worked beautifully.
Wow,
and
that's
so
amazing.
5 swift pushes and he was out. And then the midwife's like, you have a tiny little like labial, maybe a tear.
Mhm.
She's like, I mean, I'll put a stitch in it if you want. I'm like, since you're down there, you might as well.
Yeah, might as well.
But it's amazing how as soon as I had him, stopped.
That's been my experience 100%.
Stopped. All the contractions stopped.
Yes.
And you're like, I just had a baby without medication.
Yeah.
This is crazy.
Mhm.
And you feel like I can do about damn anything now. I mean,
Yes.
it was wild. I was exhausted. And they lay him on my chest and they're like, finish. You know how you have to birth your placenta, which I don't even remember that.
Same.
They stitch up my one. She was like, oh, and we're done.
Yeah.
And I just remember laying there being like, oh my gosh. And then this is the kicker, is I went in completely unmedicated, right? But in the hospital, it's very protocol.
Mhm.
And so they come in, I'm in baby heaven now. I'm like, oh my God, I'm
Golden
exhausted,
hour.
right? I just pushed a baby out. He's on my chest.
Oh.
Still have my IV in, and they are about to start pushing Pitocin.
Right. For your contractions, to get your uterus to contract.
Yeah. Yeah. So to stop bleeding, right? Because that postpartum, or I say postpartum, after you have the baby, sometimes they'll push a little bit of Pitocin. Pitocin will help the uterus contract, which helps constrict the blood vessels to help with some postpartum bleeding and hemorrhage. Great if I needed that. But then I looked and asked the nurse, I'm like, well, am I bleeding excessively? And they're like, well, let us measure it really quick. And you're like, well, thanks,
Yeah.
And my husband caught that because we had some form of preference, I'll say, when we went in.
Yeah.
He's like, wait. What do you mean Pitocin? She hasn't had any. Why are we giving her Pitocin now? And I think he didn't really know why. Like in my head, I was like, okay, if I need it, that's fine.
He at least knew Pitocin. Yeah. I know that word. I know she doesn't want it. I'm going to advocate, or I'm at least going to say, hey, pause. Let's talk about it.
Yes.
Yeah.
I mean, and it was legit like medicine is here about to hook up. And he's like, woo, does she need it? And the midwife's like, oh yeah, let me just measure your bleeding really quick. And they just slide something underneath your tissue, see how much you're bleeding, right? Yeah. And if it's a certain mil, then yes, you should probably have it. And if it's not, she's like, no, I mean, your bleeding looks just fine. And so that was like a really quick catch. But if we wouldn't have talked about that and thrown out those words, he would have had no clue. Yeah.
That's why it's so important to have a doula or a husband or a partner who knows your preferences and is involved in the prep process.
Yeah. Yeah. It doesn't even have to be, like I tell people, if it's a sister, like just get someone else on the same page as you.
Exactly.
Right. Like that was on my birth plan, complete unmedicated.
Yeah. But it's only there for you.
Right. Yeah. And that to me was like, good job, babe. Like that in my head, I was like, way to go.
That's awesome.
But my recovery, the wildest thing after having 2 babes with an epidural, my second, I remember getting up like and you're like Bambi on ice. You're like,
Yeah.
"Whoa," you know, because your legs are still so numb from the epidural. That epidural was beautiful. Like I could still feel a little bit, like that's what I wanted. But I remember getting up and then I just bled all over the floor. I was mortified. I'm like, what's happening? And then they have to help you into the wheelchair and then they wheel you to mother baby.
Yeah.
And it was just like such a foggy postpartum. I remember being like, you get the shakes, like the postpartum shakes that no one talks to you about, right? A lot of that's coming down from some of the epidural medication where you're literally like shaking, your teeth are chattering. And could be the like drastic change in hormones coming down from the medication, like the anxiety, like all of that can come into play. No one had told me about that with my first. I thought I was dying. And they're like handing me this baby and I'm shaking and everybody's trying to give me a blanket. And I'm like, I'm not cold. I just can't stop shaking. And then itching. And I was all from the epidural. Second, I knew about that. Get into the hospital or get into the wheelchair. And I'm like, oh my gosh. So, but just such a fogginess after that. And then with the third, they're like, okay, you ready to go? I legit like get up and like, they still want to take you to the wheelchair, but you're like, get up and you just walk. And you're like, it doesn't hurt that bad. I mean, it doesn't feel great. Right. And then I had such a clear head and had such a better postpartum recovery. I think truly because I let my body do what it wanted to do. And I wasn't like pumped full of a lot of medication.
Right. I mean,
crazy. From baby 1 to baby 3 and to have like 2 completely different birth experiences is like wild.
It's amazing. It's absolutely amazing. Something that I've heard you talk about before is prehab, which you and I have talked about as well. Is like there is this, expectation when you're going to have a major surgery or run a marathon or you're training for something incredibly physically demanding that you prepare for it. You prepare your body, you prepare your mind. You do all these things. And we're not encouraged to do that with birth, which is so insane because it's one of the most important psychologically, physically experiences you'll have in your life.
Right.
And yet we're given no preparation. So I'm curious with your practice, what you recommend people do pre-birth, or even pre-pregnancy, pre-pregnancy, during pregnancy and post. Like what are the things that you recommend?
I think every woman, if you have ever had a menstrual cycle, I think you need to have your vulva and pelvic floor assessed, right? Just to say, oh, okay, that's what it's supposed to do. Great. Because it affects pee, poo, and sex. Pretty important topics in my world, right? Sometimes the order will flip-flop, right?
Depending on the day.
Depending on the day, time of day. But then you really think about that, like of times we've been constipated, times we've given ourselves a hemorrhoid or something like that, right? Like we've all been there before, even pre-kids. That time where you laughed so hard or jumped on the trampoline that you leaked, right? That time you had really painful intercourse or you felt like a deep, like aching in your pelvis. Like I just think every woman needs to know. And so during like pre-pregnancy, it's all about just understanding. Like you have a vulva. That is what you see in the mirror. Can you pick yours out of a lineup? That's my like one thing I always say. I'm like, you should be able to see all these vulvas and be like, mine is the third one from the right.
Just like, your nose or
you
your
got
eyes.
it. You got it. And you should be like, oh yeah, I do know that like I have a little asymmetry between my left labia minora and my right. Like you should know that. You should know where your clitoris is. You should know where your clitoral hood is. You should know where your vestibule, like you should know where everything is. Right? Because I had a 35-year-old woman a couple months ago say, I was today years old when I realized you didn't pee out of your clitoris. And she has 3 kids.
Wow.
That's a big deal.
Yes.
And
I hate that for her.
I know it makes me really sad. So pre-pregnancy, it's all about understanding. If you have any sort of dysfunction, absolutely, let's check everything out. We want to know, can the muscles contract? Can they relax? Can they coordinate with the other muscles of what we call the core, which is the abdomen and back and pelvic floor and the diaphragm?
And I do think there's this perception too that like you don't need you don't need pelvic floor physical therapy until you're pregnant or even postpartum.
Right.
And so I really want everyone to know that like you should see, if you're a woman and you have had a period, you should go see.
It really is like, it's almost, you go for like a well woman visit and they just like scrape your cervix and they're like, oh, see you later. This is kind of how we see it. It's almost like a well woman visit to be like, wow, your skin looks fantastic. Or, oh, wow, you actually have some clitoral adhesions. Did you know that? Right. Let's not wait until you're having difficulty with orgasm before we address this. Like there's so many things that go into play. But then during pregnancy, it's things change so drastically.
Yes, everything changes.
Everything changes. And so we actually look at the body as a whole.
Mm-hmm.
Yes, we focus mostly on like the pelvic floor, the exit to which baby is going to potentially come out of, right? But we just need to also understand its function.
Yeah.
So and I'll give you like perfect scenario, 20 weeks, you're out of that first trimester ick, usually. Your body has changed, but not so drastically to where you're extremely uncomfortable. But you might start having some hip pain, pelvic pain, low back pain, because it's changing enough. So we need to establish what is the function of you right now.
What's the baseline?
Yeah. Where's your alignment? Does your pelvis have good alignment? How's your core? Can your core engage appropriately? Are you only engaging your six-pack muscles? Are you engaging your deep core, right? Because all of that is going to set you up for a very good postpartum recovery.
Yeah.
That's the goal.
Yeah.
And so at 20 weeks, it's a baseline. This is where you are. Everything's working great. You're not having any issues. Perfect. Then we work on our foundations. Then from there, we say, okay, the pelvic floor is not just supposed to contract. It's actually supposed to close and lift, but it's also supposed to fully relax. That has to time with the breath work. Inhale, diaphragm descends, pelvic floor lengthens. Exhale, it all elevates together. That should also co-contract with the abdomen. That's what we're checking. Once we've established those foundations, right? Now we're probably close to like 30, 32 weeks. That's when we're like, okay, now it's all about lengthening of the pelvic floor.
Yeah.
So if you think like if you make a little U shape with your hand and you take a fist and you put it right at that U shape, that U and pushing that fist out, that U is what really expands. That is the pelvic floor. Okay. So as that fist is coming through that U space, the pelvic floor really should stretch. That's what we're teaching now, is we're teaching the muscles that stretch is okay. Because if you've ever gone to yoga and you haven't been to yoga in a while and they're like, let's touch your toes.
Right.
It's like you're trying so hard, but you're actually like gripping and holding because it doesn't feel good.
Right. I was going to say, what do you do when you're in pain?
Yeah. And so we're just teaching the muscles, the stretch is okay. To say, oh, okay, I can tolerate this. Let's get some more length and more flexibility in the muscles.
Yeah.
We're not stretching out your vagina.
Right.
The vagina is like a shapeshifter anyway.
Yeah.
You know, I mean, it really is. It's just like an accordion.
Yeah.
And so you hear like, I didn't tear my vagina. You tore your perineum or your pelvic floor muscles or the tissues around it. Right. And so then at that point, once we've been able to figure out, wow, I can actively relax my pelvic floor, then we start our perineal prep, which is usually around 34 weeks. Yeah. That's when we get in and we kind of stretch that U shape. So we look at it like a clock. So the space between vagina and anus, that's your perineum, right? Okay, or your perineal body. And then up top, we call that 12 o'clock. That's like your urethra and clitoris. Right. We're going to stretch from like that bottom of that U. We're going to stretch from 4 o'clock to 8 o'clock. Okay. And so we start working on not only stretching the muscles, but the tissues around there. Right. And then we teach you guys how to do it at home. Yeah. All you're doing is teaching the muscles that stretch is okay. Then once you've established, wow, you have really good foundations. You can lengthen. You know what a good contraction feels like. Your muscles can tolerate stretch. Guess what I'm going to do now? I'm going to teach you how to breathe and appropriately bear down on your pelvic floor or pushing. I don't even like to use the word pushing because pelvic floor's only role is to get the hell out of the way. That's all we're teaching it. Right. Is to say, hey, sure, we'll move.
And because your body really does the rest of it.
The uterus is pushing the baby out. And so now we just have to encourage that lengthening and then appropriately bearing down like we do during, or should be doing during bowel movements to just create space and apply a little bit of pressure. Yes. When we hold our breath, we increase our pressure in our abdomen. It's not really doing anything to our pelvic floor except putting extreme pressure. Yeah. That's when we see things like prolapse, when we see things like increased tearing. So we are legit one finger pad right at the pelvic floor inside of the vagina and say, show me what you think pushing is. Yeah. And we're like, that's beautiful. Oh my gosh, this is great. Or we're like, that's not going to get a baby out. Let's try this again. And we'll start to time it and coordinate that with the breath.
It's amazing.
That's prehab. Yeah. And then we do that perineal prep weekly from 34 until you have that baby. Yeah. And so within the sessions, we're like, okay, do you know what laboring down is? Let's talk about the peanut ball. If you're feeling back labor, try this. Your partner can provide a double hip squeeze here or a sacral press here, or, oh, you don't like being in quadruped? Let's do this and sitting on the ball instead. And so we start talking all this labor prep as well. Yeah. So then when you go in, we've talked, what's Pitocin? What's this? What's that? What's laboring down? And so you go in and you at least know what to do for your body.
Yeah. I remember, I'll never forget when I was giving birth to my first son, and I did not have an epidural, and I was vocalizing, and I had read all the things, and I
Mm-hmm.
knew the importance of breath work. And the OB who was there said, stop breathing, basically. I was doing what I wanted to do, what felt natural, which was moaning,
Oh yeah. Oh
as I
yeah.
was
Let it
contracting
out.
and pushing. And she was like, don't make so much noise. She didn't say it like in the sense of like, you're annoying me, but it was like, that's not how you should be doing it.
Right.
And I remember, even though I knew better, I
Uh-huh.
still was like, oh, well, the doctor is telling me not to, like,
Yes. Yes.
but yes, it's so important, that breath work. And if you think about it, you think about yoga and, how you breathe with movements, and it feels
Mm-hmm.
good and it's
It
natural
does.
and your
Yes.
body opens. And
Well, I can tell you this. In the past 3 or 4 years, I've probably had at least 6, if not 7, midwives, OBs, and NPs in the OB field
yeah.
come and see me and being like, I don't know what you're doing, but I got to know what you're doing
Mm.
because something's helping.
Wow. That's
Like,
amazing.
or we'll have patients to be like, they were so impressed with my pushing.
Yeah.
Or like, they couldn't believe I couldn't tear,
Yeah.
considering that I have a history of pelvic floor overactivity or.
I had a previous tear.
Yeah. Yeah.
Mhm.
And then we've actually started tracking a lot of that because makes such a difference.
Yes, it
It makes
does.
such a difference.
It's
And
real
it's so
results.
cool to see the outcomes,
Yeah.
and people are thrilled.
As
you
they
know?
should be.
Mhm.
Yes. It's amazing. I mean, these are the results we should expect.
Mhm.
It shouldn't be the reverse, which it
Yeah.
is
Yeah.
that we as women expect to pee after we have a baby, when we
Oh.
laugh. We
Yeah.
expect for there to be pain.
Yeah.
We expect for maybe our sexual experience to change.
We already have hormones and perimenopause
Right.
like on the horizon. Don't be throwing anything else at
I
me.
know, right? It's already hard enough.
Yes.
And so I think that for whatever reason, there's this perception that it should just be hard.
Yeah,
after you
like
have a
you're a mom
baby.
now. Sorry.
Yeah.
And
We're kind of martyrs,
think, our society, unfortunately, it's like, okay, you need to work like you don't have kids, but you need to take care of your kids like you don't have, work to do,
Right.
which is absolutely unacceptable.
Yeah.
And so for us, the way we think about it is if you can prepare your body, especially with your 1st, you ain't got nothing, you ain't busy.
Yeah.
You think you're busy. You know what I'm
Just
saying?
wait,
Like,
I
it's
know.
comical, right?
I
Like,
know.
you think you're busy. Like, I think back to college. Remember how busy we were
Oh
in
my
college?
gosh, yes.
I'm so busy.
I don't know how I'm going to squeeze in this
And
workout.
like, I have to meet someone for margaritas at
Yeah.
4. I mean, I don't understand how I can study again.
I know.
And then you go to grad school and you're like, oh, I'm busy. And then you're like, oh my gosh, do you have like your first baby? And you're like, this is comical.
Yeah.
And now I have 3, and now the house is just batshit crazy all the time, right? But yeah, I think it's just if we can plan during that pregnancy, fitting it in just like you fit in anything. Like if you can go get your nails done, you need to come see us at least for 30 minutes to an hour.
Priorities,
that's
ladies.
the reality.
Yes.
And your body's going to thank me later
Yes.
because now we've been doing this long enough that we have women that didn't have this before.
Yeah.
And the one thing they're like, I wish I would have known.
I know. And what's so cool too about you were saying how you teach people how to push
Mhm.
is this applies when you have an epidural too.
Yes.
I think a lot of people think that a lot of this prep work and stuff is more so if you want to give birth more naturally or without medication. But I was speaking to someone recently who did pelvic floor therapy and then she gave birth with an epidural. And she said, and I remembered in my preparation, I knew how to push.
That's
and
exactly
pushing was
it.
so much more effective with the epidural.
And it's okay. Epidurals are fine.
Yeah.
They're there for a reason.
Absolutely.
It hurts like hell.
Yeah.
You know what? I was asking for it too.
Yeah. Same.
Yeah. And so I think there's like, I think people think you have to do it this way or you have to do it
It's
this
all
way.
or nothing.
No, absolutely not. Now, if you can wait till about 6 or 8 centimeters to get that epidural,
Right.
your body now is progressing. You're in active labor. The likelihood you're going to continue to progress is higher.
Right.
The likelihood that you're going to need another epidural or you're going to need other intervention is lower. And so that's really what we push for.
Right.
You go, if you want that epidural, girl, you get that epidural. Right. If you want to chill and put your makeup on, girl, you do you,
yes.
right? Because that's completely okay. But I promise you, right? It's like, I always say, it's like moving around your house at nighttime, right? You've done it enough to where, you got to like step around the corners so you don't hit your toe.
Yes.
If you practice this stuff enough, it's like walking around your house in the dark.
Yeah.
Even though you can't see it, even though you can't feel it, you're still going to be able to do it.
Right.
Because you've trained yourself appropriately.
Or training for a marathon, which by the way, I would never choose to run a marathon. I did choose to
did one.
Oh my God.
I did one.
I don't know. I'm really surprised that I wanted to give birth without an epidural because I normally, I'm not someone who would ever run a marathon or anything. But, from what I've heard and read with other people who have, you train your mind, you train your body, you know, at mile
Mhm.
XYZ, it's really hard for me because I've done this a
21
million times. Right.
every
But you know that
time.
you're going to get through it. Similarly, you know that at 7 to 8 centimeters dilated, it's going to be really hard, but you're going
Yep.
to get through it. And
Yep.
so, yes,
Temporary.
preparation,
Yes.
temporary. Yes.
And I think that's the thing. It's like, it's the hardest thing like, yes, I ran a marathon.
Mm-hmm.
And was that hard? Yeah. This is the thing. Would I want to do it again? No.
Yeah.
I did a bunch of halves after that, right?
Yeah.
Which is fine. And I always just felt like that was just like, okay, great. I did a marathon, check. We can move on.
Yeah.
That was hard. I did train with my husband. I don't know if that made it harder or what. But mile 20 and 21 always tripped us up. It was more of a mental game.
Yeah.
You know, did my quad really hurt? I don't know.
Mm.
Did I really? It was just like, I just was done mentally. And then you get through it. You're
Right.
like, all right, mile 20 is coming. You good? I'm good. You good? You good? Okay.
And you keep going.
You just keep going.
And it ends.
Yes.
It ends.
It does. And then you feel it for 2 weeks. It's just like birth.
Yeah.
Yes. But it's like you put in that prep work beforehand. And I
Yeah.
think that's the biggest thing is just ignorance is not bliss. It's just not.
Yeah.
Because then on the flip side, there can be so many other poor outcomes that mentally you might not be ready for. That's what we try to minimize.
Yeah.
Because postpartum, not only you don't need to waste time taking care of you, like you need to be at your optimal level of function.
Right.
Because now your priorities and everybody else's priorities shift to that baby.
Right.
So it's hard to take care of yourself.
Yes.
So we get a lot of moms that don't do prep work and they don't come and see us until they're 3 years postpartum and out of the fog. And they're like, sex still hurts. And you're like, because your scar is so stuck down. Right. Or they're lactating and they're like, I don't know what's going on. You're like, you're dry as a desert.
Yeah.
You have no estrogen right now. You're lactating. And they're like, oh, that's what it is. Right. It's knowledge, just knowledge.
Just knowledge. What's the most common symptom or issue that women come to you with postpartum?
Postpartum. I'll give you my top 3.
Okay.
I would say urinary incontinence, of course, painful intercourse, and diastasis, like ab separation. But they all kind of go hand in hand. Usually we almost all have some form of separation postpartum, which is fine. It's more of like just a dysfunctional unit than truly the separation. Yeah. Right. But that unit is about pressure management. So you think if you have like a little balloon, that's your bladder, and you have a lot of pressure on top of it, that's going to be really hard for that balloon, especially if it's not tied up, to hold all that air. It's going to leak right out, right? And so it's the abdomen plays such a vital role with that. And then if anyone's had any tearing or like the change in hormones, that can really affect the tissues. Like it can make the tissues extra dry and have more friction and just make them like a little more sensitive, almost like a ripping sensation. Yeah. We see that, but we actually see a lot of painful intercourse post C-section.
Really?
Than anything else.
That's so fascinating. Tell me more.
So you've had a major abdominal surgery.
Yeah.
I encourage everyone to potentially watch a cesarean birth because damn is all I have to say. It's wild.
Yes.
It is. I mean, you're filleted open. Oh, and you're awake, which is even crazier. I mean, it is. I encourage everyone to understand a C-section, even if you're like, I'm going to birth in the woods with the squirrels.
Right.
I'm like, that's fantastic. Let's talk about a C-section. I will talk about it with every single one of my patients.
Yeah.
Major abdominal surgery, low on the abdomen, right? What do we do when we're in pain? You've already said it. We tense, we guard, we hold. Yeah. I've already said the core and the pelvic floor co-contract.
Yes.
So everything now is guarded and holded, rightfully so. Right. And those muscles have a really hard time letting go.
Because your core has been cut through.
Literally.
Yeah.
Like 7 layers of it.
It's so interesting, Amy. I've never thought about it because I think a lot of times people joke like, well, at least if you have a C-section, you get to avoid all the vaginal stuff. And that's not the case necessarily.
Yeah. Urinary incontinence, same thing. It's like, if you got your abdomen so tight, you've decreased the amount of like flexibility in these areas too. And so that, again, it's all about function. It's like the whole unit has to function together.
Yes.
And so yes, we'd love to see you pre-pregnancy, figure what everything is. Some people are like, oh yeah, you know what? I was a gymnast and every time I would land from my full, I would leak. That's pelvic floor dysfunction.
Yeah. That was me as a ballet dancer.
Yeah.
All throughout my teenage years, I had incontinence. And
Mhm.
I remember thinking like, I'm too young for this.
Yeah.
And did I do anything about it? No,
Yeah.
not until after I had kids.
Right.
Yeah.
Right. Yeah. Absolutely. Constipation's another big one.
I was going to say I was going to ask you, what is the symptom that people would be most surprised to know is pelvic floor dysfunction? And
Yeah.
would you say
I would
constipation
say constipation. I think everybody wants to attribute it to like gut
or diet? Yeah.
or diet. Yeah. And no, not necessarily.
Mhm.
I think a lot of it is like incomplete emptying.
Yeah.
The pelvic floor, like if you put one finger to the sky and you wrap the other finger around it, like that's the pelvic floor muscles. They literally wrap right around the rectum.
Mhm.
And if you kink that rectum, it is very hard for poop to come out of a kinked rectum.
Right.
And so you have to think any sort of overactivity or dysfunction down there can cause that. But then if you think you're bearing down and you're actually squeezing your pelvic floor, just like with birth, something's trying to exit and you are closing down the entrance, not letting it open.
Yep.
That is why this is important for birth.
Yeah.
And that is why this is important for pooping.
Yeah.
And so I think that would probably be the main one that people are like, oh, I had no idea. Back pain is another one. Like the low back sacroiliac joint, hip pain, even like lateral hip pain, that can usually be coming from pelvic floor too.
It's so fascinating.
It's just muscles.
Yeah.
And it's crazy. Even in PT school, you just like breeze over them. And you're like, what are we doing? There's 13 muscles on there. That's wild.
And they're literally responsible for daily functions.
Daily and supporting your pelvis, which
Yeah.
takes the brunt of everything.
Yes.
And your little hips.
Yeah.
Like, what is going on?
Talk to me too about men and how they can benefit from
Oh,
pelvic floor
yes.
therapy.
So I do not treat men. So I'll give you the knowledge that I do
Yeah.
know. I'm very good at treating women.
Yes.
But no, I have colleagues that treat men, and a lot of things that they get is erectile dysfunction. But after prostatectomies, having any sort of prostate issues is a big one. Like pre-ejaculatory issues is another one. Just general pelvic pain, hip pain is a big one for them.
Constipation as well.
Constipation as well, yeah. And then for us, we usually do most of our exams vaginally, but there are some muscles that we have to reach rectally, which again, it's just a different entrance.
Right.
But for men, they just do it all rectal.
Yeah.
Just no, thank you.
Yeah. That's right. You picked your specialty.
You pick your specialty. I am great at what I do. And other than that, I'm like, I know that it is out there and I know exactly who to refer to. Yes. But yeah, I mean, it's the same thing, pee poo and sex for them as well.
Yeah. Yeah. I mean, it's just fascinating. Like you said before, so much of what people think is woo woo is not. It's not science. It is very clear. So we can talk about it all day long.
Absolutely. I mean, we'll have like part 2 to talk about all like the nerdy science stuff that I love to dive into.
Same.
As long as you're ready for it, right?
Same. I love it. Absolutely. Well, this has been amazing. I do always like to close out my episodes by bringing it back to birth and asking you to describe birth in 3 words.
Ooh, that's a good one. You should have let me plan ahead.
No, I like to surprise people.
Oh, okay. Magical would definitely be my first. It almost wants to like bring you to tears to talk about it sometimes.
Yeah.
Difficult, empowering.
I love that.
I
love that. Yes. Well, Amy, thank you so much for being here.
Very welcome.
It's been a joy to talk to you and spend more time with you.
Absolutely.
All right, guys. Well, you've been listening to the Arrivals Podcast. Until next time.